talk about burnout as a medical provider, here's exactly how you get burnout as a medical provider. So this person is asking, can I, as a PA, as a physician assistant, but the same thing would apply as a nurse, an RN, a doctor, an MD, a DO, any kind of like healthcare career where you have a high level of decision making, I would say is in the same category of being at a high risk of burnout, especially if you do stuff like this. So this guy is asking, can PAs work 50 hours if they want to, or is excessive hours only reserved for the doctors? No, I mean, you can work as much as you want in any career as long as you find the right gig. So not everybody just works 40 hours and then they go home. In medicine, you usually don't have that, right? Like most PAs I know have a full-time job. Some people have a full-time and a part-time job, usually not forever. Usually it's because you're paying off a house, you're paying off student loans. You might have a kid you're putting through college. For some reason, you just have to have some extra income. So a lot of people might have a full-time job and a part-time job. Some people who are really smart, some people have just a couple of part-time jobs where they're more empowered and in control of their own schedule and their own time. Some people have like 2 or 3 part-time jobs. Some people just work one part-time job because thankfully as a PA, especially as a doctor, but as a PA, you know, working part-time, you can still have a decent lifestyle. You're not going to make a ton, but even working part-time, 20, 30 hours, you can have a pretty decent life. You can have a decent income. So, you know, some PAs just do that. And I would actually say those PAs are the smartest. Those PAs are in it for the long haul. Because in my personal opinion, I've only been in practice 4 years. Somebody can totally disagree with me. But in my honest opinion, in my humble opinion, I don't think that a medical provider, I can only speak for providers. I don't know about nurses. I don't know about support staff. I can only talk about a provider who makes, you know, big decisions where somebody really could get hurt. As a provider, I would say that you should not, on a long-term basis, work more than 30 hours a week. Ideally, for your mental health and for the quality of your patient care, I would say even less than that. Now, that's just me. You know, that's just me and my personality. I find that when I work too much, it becomes a grind. I actually even start to hate it. I lose, you know, a lot of the empathy that I really want to bring to patient interactions. I lose the love of practicing medicine. I forget how cool it is. I forget how lucky we are to really do this, to be able to take people out of their pain and their suffering, to teach them things that might help them with their health, to be more productive, healthy, happy, functional. I forget how amazing it is to be a medical provider when you just have to do it too much. Whether that be too much in one day, being forced to see too many patients, and therefore not being able to give each one the attention that, one, they want and need, and two, that you would really love to give them. But you can't, because, you know, the longer you give somebody else, the less time you have to give whoever the next person is. And then now they're angry because they're waiting, you know, and then also, like, the more people you see, the more you realize you have to remember things and document things, because you can't forget things that you document, because now you set yourself up for trouble. And it's such a broken system. I feel like a broken record talking about this. But the video is not about going off on a rant about how bad the healthcare system is in America. This video is about preventing burnout. So doing stuff like that, working 50 hours as a provider, I wouldn't do it. I've done it. I've done 60 hours. I've done more. At one point, I think a couple months ago, I worked 7 days in a row. Some of those were 8 to 9 hour shifts. Some of them were 12 to 13 hour shifts. You know, and sometimes an 8 hour shift turns into a 9 or 10. Sometimes a 12 turns into a 13 or a 14. That's just, unfortunately, the nature of the beast sometimes. But my point is, yeah, 7 days in a row. I forget how many hours I clocked that week, but it was more than 60. 5 days at 12 hours was, what's that? 60 hours plus 16, 72, 76. Was I approaching 80 hours that week? I don't know. I'm not doing the math in my head very well. But yeah, I worked 7 days in a row at one point. And, you know, by day 5, I think day 5 was kind of the hardest, because it's like, man, I've got 2 more days of this. But then day 6 actually was a little tiny bit easier, because it's like, man, I only have 1 day to go. And then day 7, you're just coasting, because you're like, yes, this is my last day. It's my last day out of 7. I did it. You know, I'm almost home free. It's like, it just mentally it's like that. It's like when you're running a 10K, you're running 6 miles, the 5th mile is always the hardest, the 6th mile is easier because you're almost done. So either way, my point is burnout in medicine is very real. I would probably say, especially as a provider, because everything is just up to you. The decisions are up to you. And like every single thing you do is so risky, and you really have to bring all of your compassion and all of your understanding and all of your knowledge and ability to each interaction. And like, it's just a lot. It's a lot. It's hard to just go through the motions, because as a provider, once you start going through the motions, you start missing things. And then suddenly that stuffy nose is no longer just a stuffy nose. You miss something important, or stuffy nose, less likely to be something serious. A cough could be about a billion different things. It doesn't have to be viral. It doesn't have to be bacterial. It doesn't have to be pneumonia. It doesn't have to be asthma. It could be a freaking pulmonary embolism. Like you have to bring your A game clinically to each interaction, and once you do it too much, even in the same day, that starts to be very difficult to do. If you do it too much in the same week, it becomes very difficult to do. If you do it too much every day for a week, it's just, ugh. So yeah, guys, if you're new medical providers, if you're students, if you're new grads, if you're even, practicing a few years like me, I know it's tempting to pick up a lot of extra shifts and make a lot of extra money, and maybe for a very, very short period, you would do that, but realize that everything else suffers. Everything else in your life suffers because you're giving so much of yourself to this job because it requires it. Otherwise, you're putting yourself and the patients at risk, that everything else in your life for that time that you're doing it is going to be on the back burner. There's no other way around it. At least maybe for other people. For me, no. Maybe I'm not that strong of a person. Maybe I'm just not that capable of a person or a provider. But I find that if I'm working that much, everything else kind of gets put on the back burner, and I just can't give that much of myself. I don't know if that makes me weaker than other people, but I personally think that working more than 30 hours or so, I put myself at risk of burnout. So, 40 hours definitely. 50, 60, you can't, it's not sustainable. So for this person, I would personally recommend not doing that.